Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about the complications of sinusitis. For sinusitis, this is the last video it seems. Or we can have a video on fast surgery. So what are the complications of sinusitis? First, we'll divide it into the local, orbital, intracranial and descending infections. Okay? Local, orbital, intracranial and descending infections. Let's see the easiest one first. Okay, descending infections. So suppose this was the face. Okay, so this was the megalusinus. From here it can descend down. Now it can descend down. The first thing that it will find is adenoids in the pharynx. Okay, posterior wall of pharynx we have adenoids. So first thing is adenoiditis. There only here on the lateral wall of cavity we have tonsil. So tonsillitis, adenoiditis. Then in pharynx we have pharyngitis. Then it can go to larynx. So we have laryngitis, or at the end we can have tracheobronchitis. So very simple is descending infections. Adenoiditis, tonsillitis, pharyngitis, laryngitis and tracheobronchitis. So this is the descending infections which are the complications of sinusitis. Coming to the intracranial complications, it's very simple. In intracranial complications, we have meningitis. Okay, if there is accumulation of pus between bone and dura mater, we have extradural pus. If it is just beneath the dura, we have subdural abscess, and if it is in the brain, we have brain abscess. Very simple. Suppose this was in the ethmoid sinus, okay, anterior ethmoid or posterior ethmoid. First, it can go to the meninges, okay, so it can cause meningitis. If it is just outside the dura, we have extradural. If it is just inside the dura, we have subdural, and if it is inside the brain, we have brain abscess. So this was the intracranial complication of sinusitis. Now coming to the orbital complications. So orbital complications, we have to learn it in a sequence because this classification is known as Chandelier's classification. So we have to learn it in a sequence. So the first thing that happened as a complication of sinusitis is preseptal cellulitis. Preseptal cellulitis means that is cellulitis of lids. Septal here is lids. Preseptal cellulitis, cellulitis of lids. After that cellulitis of lids, we have orbital cellulitis. Okay, orbital cellulitis. The severe form of cellulitis is, again, now it will go to subperiosteal abscess. Okay, so first we have cellulitis, and the cellulitis have like on severity forms abscess. Okay, so first we had preseptal cellulitis, then it formed orbital cellulitis, then we have subperiosteal abscess, then orbital abscess, and then at the end we have cavernous sinus thrombosis. Okay, so this was about the orbital complications of sinusitis. Here only let's see something about cavernous sinus thrombosis. So if there is infection of ethmoid or sphenoid sinus, then it can cause cavernous sinus thrombosis. Okay, so infection of ethmoid and sphenoid. Okay, so it can go to his cavernous sinus. Orbital cellulitis can secondarily lead to cavernous sinus thrombosis. Okay, so how to differentiate between both? Okay, cavernous sinus thrombosis and orbital cellulitis. In cavernous sinus thrombosis, the main source is nose, sinuses, orbit, ear and pharynx. And in sinuses, you will see mainly ethmoid and sphenoid sinus. Whereas in orbital cellulitis, most common sinusitis is ethmoid sinus involved. Okay. Onset in cavernous sinus thrombosis. Very important point. Onset in cavernous sinus thrombosis is abrupt with chills and dryness, very high grade fever. But in orbital cellulitis, it is slow. Okay. Because it is gradually progressing. Toxemia is present in cavernous sinus thrombosis, whereas toxemia is late presentation in orbital cellulitis. So here you have to keep in mind that cavernous sinus thrombosis, it is a severe case, or it is a very toxic condition. But orbital cellulitis is toxic, but not as much as compared to cavernous sinus thrombosis. Cavernous sinus thrombosis is bilateral, whereas orbital cellulitis is unilateral. If we look for edema of eyelids, in cavernous sinus thrombosis, there is bilateral edema of eyelids, chemosis, that is swelling of conjunctiva, and proptosis present. Whereas in orbital cellulitis, there is unilateral edema of eyelids, and that too near the inner canthus and leading to ecchymosis and proptosis. Cranial nerve involvement. Here, cavernous sinus thrombosis involves the cranial nerve individually and sequentially. There is a sequence of involvement. But in orbital cellulitis, the cranial nerve is involved concurrently with complete ophthalmoplegia. So this was a little difference between cavernous sinus thrombosis and orbital cellulitis depending upon the source, onset, toxemia, laterality, and edema of eyelids and involvement of cranial nerves. So till now we have seen the descending infections, intracranial complications and orbital complications. In intracranial we have seen cavernous sinus thrombosis and brain abscess. In orbital, we have seen orbital cellulitis versus cavernous sinus thrombosis also. Okay, so till now we have seen these three things. Now we have to see the local complications. Local complications mean this is limited to sinuses only. Okay, so here we have retention cyst, mucocele, and if the mucocele is infected, it becomes pyocele, and at the end we have osteomyelitis. Okay, retention cyst means it means epithelial lined sac around the mucus. Okay, there is a sac that is lined by epithelium around the mucus. Mucocele is mainly cavity. Mucocele is thinning and expansion and destruction of bone. So mucocele is cause thinning and expansion of bone. And if this mucocele is infected, it is called pyocele. And at the last, it may cause osteomyelitis. Okay. So let's see something about these local complications. What is Pott's puffy tumor? This is osteomyelitis of frontal bone. Pott's puffy tumor is osteomyelitis of frontal bone. Okay, mucocele. Okay, here we were struggling. What was that? So mucocele, the most common sinus involved is frontal sinus, and least common involvement is sphenoid sinus because it is posteriorly involved, posteriorly present. Here you can see the proptosis of the eye, forward, downward, and laterally. Okay, since frontal sinus is involved. Okay, frontal sinus is involved. Here only eyes are there. Okay, if there is mucocele here, so it can push the eyeball forward, downward, and laterally. Sorry, forward, downward, and laterally. There will be eggshell cracking feel. Eggshell cracking feel. The site is superomedial quadrant of orbit. Superomedial quadrant of orbit. Okay, because that is in the closest proximity to the frontal sinus. The swelling is cystic, non-tender, and eggshell cracking feel will be there. On X-ray, there is loss of scalloped margins, and the treatment is frontoethmoidectomy to promote the drainage of frontal sinus. Okay, so this is about the complications of sinusitis. Okay, in local we have retention cyst, mucocele, pyocele, osteomyelitis. In orbital complications, orbital cellulitis, preseptal, subperiosteal, orbital abscess, cavernous sinus thrombosis, meningitis, extradural, subdural brain abscess, adenoiditis, tonsillitis, pharyngitis, laryngitis, and tracheobronchitis. So this is mainly a 5 marker. So we have learned about the complications of sinusitis. Here only let's learn some syndromes or some conditions. Okay, so there is something called orbital apex syndrome. In orbital apex syndrome, the cranial nerves involved are second, third, fourth, may and may not be V2 means second branch of trigeminal nerve. In superior orbital fissure syndrome, the nerve involved is third, fourth, and sixth, may and may not be the fifth cranial nerve. In cavernous sinus syndrome, third, fourth, and sixth cranial nerve is involved, and the second and V2, fifth, second branch of trigeminal nerve is not involved. So these are some syndromes: orbital apex syndrome, superior orbital fissure syndrome, and cavernous sinus syndrome. So you have to know which cranial nerve is involved and which cranial nerve is not involved. So this completes our complications of sinusitis. Thank you so much.